Are you someone who's dealing with shoulder pain after working out, particularly after a pressing day? Then in today's video, we're going to be giving you 3 things that you can start doing about that today. First and foremost is the simplest solution for this issue, and it goes about your intent of how you're performing any type of pressing movements. Specifically, we're going to be talking about a bench press today, whether that's dumbbell or barbell. Now, the thing that everybody focuses in on when they're performing a bench press is they're thinking about setting their shoulder blades down and back into the bench. Now, while this is useful, focusing on getting your shoulder blades to tip backwards, tilt down into the bench to set yourself up on a nice platform to push from, we also need to focus on the actual muscles that are doing the work, which is your pecs primarily, as well as the anterior delt doing a lot of this work. So anytime we are lowering the weight performing a bench press movement, we need to think about spreading the shoulders or widening the chest as you go down. This widening of the chest is what allows you to eccentrically load the pecs and anterior deltoid. This is the muscle that is being put under stress when you're doing the lift. So if the muscle isn't acting how it should, or to its fullest capability, which is lengthening on the way down, then we need to start focusing our intent in accomplishing that. Ultimately, what this is going to do is going to switch any focal pinpoint discomfort that you might get in the shoulder at the bottom of the pressing movement and start turning this into more of a global, distributed across the whole entire pec, anterior delt, shoulder sensation of being stressed. So it's distributing that workload over the whole entire chest and shoulder, as opposed to a pinpoint sensation that you might currently be getting with not focusing your intent on that eccentric spreading of the chest or pectoral region. Now, secondly, this is the other component to the technique side of things, and this is the reason why dumbbells offer a safer shoulder solution than a barbell for bench press. It doesn't mean barbell is bad, it just means dumbbells are generally speaking going to be a safer alternative that you can add volume with. What you'll notice when doing a barbell press is that your forearms or palms are locked into what's called a pronated position. So in this case, the palms are facing towards the camera. In which case, if we look at the upper arm, or the angle of which the elbow points out at, we want to see the hand and the elbow pointing in the same direction. This is going to place the least amount of torque on the shoulder as possible. Now, it's not that torque is a bad thing, and again, bench pressing is perfectly fine and normal. Now, a better way of describing what this looks like in practice is with dumbbells. So notice with dumbbells, we have the freedom to move the arm and the wrist at any angle that we so desire. We can continue to have that pronated grip where we keep the palms facing towards the camera and the elbows out wide as we go down. This is going to be more of an upper chest dominant movement and an anterior delt dominant movement. Or we can let the elbows drop down a little bit towards our sides at a 45-degree angle, in which case we would also want to rotate the dumbbell at a 45-degree angle to keep the relationship of the upper arm and the wrist in the same position. Furthermore, if we were to drop all the way down by our side, we really want to see the dumbbell rotate. So again, the arm or the humerus is in the same position as the wrist. Anytime you do not see this, this is when we're getting a twist at the elbow, a little bit of extra torque being placed at the shoulder, and then just a 2% increase of torque can cause a lot of stress that happens accumulatively over time, especially if we're doing this week in, week out, maybe multiple times a week. So the common area of mistake that I see is when the arm is at a 45 degree, you'll see that the pronated hands still stay facing towards the camera. So this is where we don't allow the wrist to rotate with the shoulder at the same angle. So there, again, creates a little bit of a twist, a little bit of an extra torque placed on the shoulder. It's not as comfortable. So the final component is total training volume. How much stress are you placing your shoulder under on a daily basis, but also a weekly basis, and how does that accumulate over time? So the things you're going to want to be keeping track of is how many pressing movements do you have in your exercise. It's not just flat bench press. It's not just incline bench press. A lot of people will do flat, incline, decline, and military all in the same week, and maybe even chest flies and some other dumbbell accessory work. So if you're adding that much volume into the shoulder, at some point in time you're going to reach this threshold where it just becomes too much cumulatively that occurs. So you have to be keeping track of how many total number of sets you are doing from a pressing standpoint. So for example, if you are doing, say, a dumbbell bench press on one day, and then you're also on the same day doing a dumbbell fly, and say for the dumbbell presses you're doing 4 sets and the dumbbell fly you're doing 3 sets, that would be 7 cumulative sets that you are doing. You could take it a step further and count the number of repetitions. Just so for easy math's sake, say you did 10 reps of every single lift. That would be 70 total reps that you would do in that. And then let's say on another day you do a decline press and a military press. Let's call it the same set scheme, so 4 sets of decline and then 3 sets of military. And let's say, just for easy math figuring, you're doing 10 reps of all of those. So that's 70 reps. So cumulatively throughout the week, we're doing 140 reps. And so it's this total volume that we're looking at from a most intense day. So what's the highest amount of volume of pressing that you did in one day throughout the week? And then what's the cumulative total number of reps that you accomplished throughout the entire week? And it's these two variables that we're looking at from a training volume standpoint that we don't want to see escalate too quickly on somebody. Also, obviously, we have to pay attention to overshooting or using too heavy of a weight that you're not prepared to handle for. But most people pay attention to the weight that they use pretty easily. It's this total volume that can creep up on people. Now, a good rule of thumb for a lot of people is just progress only 5% per week. But this is definitely just a rule of thumb. You can certainly, in some instances, progress quicker. In some instances, some people need to progress slower. Now, if technique and programming are an area that you struggle in and would like help with, that's something we can do at Sports Rehab Expert. We can help you out with both. If you want to know what that looks like, send me an email, greg@sportsrehabexpert.com, and we can discuss the variety of different options that might work best for you in your particular situation.